We want to make sure that we're optimizing and maximizing not just the fiscal benefit that health taxes have, but also the health benefit. Thank you for the question, and I think even to start, how do you recognize countries that have successfully done this versus those that have not? And I think the countries that have set the agenda for the future, they're able to set not only their health agenda for the future, but their economic agenda for the future. Those are countries that have been successful. And they've been successful because health taxes are a vehicle for domestic financing, but financing that is sustainable, financing that is sovereign, and financing that can have impact at scale. And so when you hold those levers and you use them to support your goals, priorities, whether it's a health agenda or broader social sector agenda, you're really able to not just have a vision for the future, you're able to define it and you're able to execute on it. And I think we've seen countries do this successfully when they take a whole of government approach. So it's not just the Ministry of Finance that are thinking about health taxes, it's Ministry of Finance thinking about it in conjunction with Ministry of Health, as well as other sectors. And that's important because we want to make sure that we're optimizing and maximizing not just the fiscal benefit that health taxes have, but also the health benefit. You know, we know that if we just increase the price of these harmful commodities like tobacco, like alcohol, like sugary beverages, we can save 50 million lives. Not only that, we can generate $3.4 trillion in just 5 years. That covers about 40% of our healthcare budgets in low and middle income countries. So think what you can achieve with that. Yeah? And you can do that, we know it works. We know that many countries have been able to implement them successfully. And so there are lots of models that we can look for or look towards successful health taxes. I think some of the critical things are making sure that you are tying health taxes to inflation and you are pegging them to the amount of the harmful commodity as opposed necessarily to just the price. Because we know that industry can manipulate pricing, and so by manipulating pricing, they can actually reduce the impact of health taxes if they are pegged to pricing. So some of the things that we recommend is making sure that you are, in your healthcare policies, they are tied to inflation and you're pegging to the amount of the harmful commodity. So for health taxes to have the maximum benefit, they have to be done right. The good news is we know how to do that. There are lots of countries that have been successful in making sure that both the fiscal benefit and the health benefit of health taxes continue across time. And so some of the tools, I mentioned earlier, making sure that they are pegged to inflation, making sure health taxes are also pegged to the amount of the harmful commodity. I think we see challenges to implementing health taxes when there's not enough public support for them. And so it's really important from the start to have dialogue with the public, to engage in a conversation with the public about why health taxes are important. Because as soon as you say the word tax, people think of it from a negative perspective, negative connotation. They think about it as taking something from you as opposed to bringing something back to you and bringing back to your family. So you really have to have that conversation about health taxes are not only going to improve your health today. We know that by reducing those harmful commodities, you have less risk for heart disease, less risk for diabetes, less risk for cancer. I mean, if you have that conversation with your family, who will not say yes to that? Yeah? Who will not say yes to saving their lives or saving the lives of their children? So you have to get that message out. And then I think the other thing to make sure is that what are these health taxes going to be used for? And so having that conversation about people understanding that health taxes can be used to now plow back into the healthcare system and support increased access or improved quality of healthcare services or other social sector needs. I'll go a little off script here, because we should not have perfection be the enemy of the good. And when we are debating health taxes, we shouldn't be having a theoretical, technical discussion about whether one way is right or one way is wrong. I think the most important thing is actually to get health taxes on the docket, get them passed, get them designed in the way, as I said, that's going to maximize both health benefits and fiscal benefits, get the public behind them, make sure that there's accountability around how these the revenue generated through health taxes actually going back to support public goals, and there's an ability for public to hold government accountable to what that they say that they're going to do. I think if we focus on those things, we can make sure that the right taxes are done at the right time, for the right benefit. And so that's, I think sometimes, us technocrats, get all caught up in our wonky debates. It's important for us to think about the big picture, which is around how can we implement the best design of health taxes so that they save the most lives and they're generating revenue that can support broader government priorities. So it's interesting you brought up the term global. Because what we see is that the industry opposition looks the same wherever you are. We're also seeing lots of similarities in industry opposition, from tobacco to alcohol to sugary beverages. So they're using the same arguments, and it's not by accident that the opposition is using the same arguments. This is a targeted campaign to prevent health taxes from moving forward. And the reason it's a targeted campaign is because they know health taxes work. And they know if the public is behind health taxes, we are going to see reduction in consumption of those harmful commodities to the detriment of industry, but to the benefit of the people. And so part of this is making sure we're fixing the price tag on health. Part of this is making sure that we have a very intentional, as I said, campaign to educate and inform public and make sure that they are not listening to the myths and the misinformation and the disinformation from industry, because we know that what they're sharing is misinformation and disinformation. So we also talk about health taxes being the triple win. We're not just raising revenue, we're reducing healthcare burden on the healthcare system. We know our systems are already overwhelmed. Think of what's going to happen in 10 or 20 years' time when you see the ill effects, of taking these harmful commodities. Our systems will not be able to address all of the new people that need healthcare services. And then we also talked about the saving lives. Now, I think right now, there's also a huge confluence of different events that makes this a very positive or enabling environment for advancing health taxes. You talked about the reduction, the cuts in global health financing. We also are seeing new renewed commitments for health sovereignty, at the national level and national governments setting their health strategies. I think the other thing that I'd love to see become part of the conversation is all of the investments happening now around digital public infrastructure. Previously, it may have been hard to actually make the argument around health taxes because people were not feeling the benefits. We know that in many of our countries, the health tax administration can be weak, can be fragile. We may not be able to have a lot of transparency around what's happening with tax, and tax naira. But now, with investments made in digital public infrastructure. So we know where financing is flowing, we know where the money is flowing, we can follow it. Yeah? We can also make sure that everybody is counted. You know, everybody gets a birth certificate, everybody gets a digital identity, you know, a digital ID card, so they're in the system. And we know that when people are in the system, that's the first step for making sure that they have access to the rights, benefits, and services, you know, that they need, but also that they have the right to. And so right now, one of the previous arguments that a lot of people made against health taxes, which was, we don't have the transparency, or we may not have the ability to have accountability. Now with the investments in digital public infrastructure, I think that argument, we can put it to the wayside, we can put it to history. And so the challenge now is, how do we get all of the folks who are working in these different areas, so Ministry of Information Technology, to actually come now together with finance, with health, and make sure that we do this in the right way so that it's durable, so not just from a design perspective, but from an implementation perspective, and that the impacts are felt, are experienced by our people, for generations to come.